Dr. Lalu Joseph, your kind words on this momentous occasion.
Very good morning and thank you very much for joining us today. I'll talk a little bit about the organization I'm representing, which is CAHO. CAHO is the consortium of accredited healthcare organizations in India. It's a not-for-profit society established in 2013 to promote quality, patient safety, accreditation in the country. As you are aware, healthcare is a very unsafe industry. It is not, as you think, where patients are very safe when they come into the hospitals. There can be medical errors that can happen. Wrong patient can be operated. Wrong site surgery can be performed. So our whole idea is to promote safe practices in healthcare. And we are a not-for-profit society. We work with every hospital in the country. So there is an accreditation framework in the country known as NABH, the National Accreditation Board for Hospitals and Healthcare Providers, and their aim is to promote quality and patient safety and to provide basic minimum standards to the patients when they get admitted in the hospitals. So our job is to promote safe practices in the hospitals, and we have membership across the country. Today is a very proud moment as we join hands with 4 countries and launch CAHO International this evening at Taj City. So what we have learned in this country with regards to building capacity in hospitals, training programs, conducting them in our hospitals and enhancing the patient safety in our hospitals, we wish to join hands with other countries and promote that in our neighboring countries as well. So the next 2 days, starting from today is the CAHO LabCon, and we have about 350 delegates from the diagnostic division who have joined us. Tomorrow and day after, we have the CAHO conference. We have about 1,500 national delegates and international delegates joining us from all over the country and world. We have excellent speakers on quality patient safety who are going to be deliberating on the next 2 days. And with the presence of the Governor of West Bengal as the chief guest, we are honored to be hosting this event in Kolkata. This is the biggest event conducted by CAHO so far, and we really thank all the hospitals in West Bengal who have joined hands with us in promoting this journey of quality, patient safety and accreditation. I think Dr. Agarwal, our president, will be able to throw more light on how we are engaging with patients to promote quality and patient safety. I'll hand over to Dr. Agarwal.
So, friends, I am sure that what has been already emphasized to you, that patient safety is a big issue. Preventable medical errors is a huge problem. In a country like United States, where you can say the accreditation systems have been in place for more than 75 years, and in that country, they are spending the money on healthcare which is equivalent to the GDP of our country. It's 18% of their GDP, which is like more than $4.5 trillion. And even then, preventable medical errors result into the third leading cause of death in that country. So you can imagine as to what must be happening in any lower and middle income country, including ours. We have the, of course, benefit that we don't have the data. So it's all right, you just sweep everything under the carpet. But the preventable medical errors is a huge problem, and this can be seen by the fact that there is a huge amount of increase in litigation against the medical professionals. There are instances of violence against the professionals. All of that cannot be justified. However, the profession has to do also an introspection, and we have to work towards making healthcare safer. Why is it happening? It is not that the doctors are callous or anything. I think one major thing that has happened is that healthcare delivery is now become a teamwork. At one time, in our time when we were just starting practice in my 60s, this was more like between a doctor and a patient only. But today, when a patient comes to a hospital, it is a team of people who are going to be responsible for the end result. And doctors have not learn to be the captain of this team. They have to become the captain of this team. They have to get involved, that there is more coordination happening between all of them. And that is what CAHO is now focusing on, is to go to every segment in the hospital ecosystem. It's not only the doctors and the nurses. We are also reaching out to the engineers. We are reaching out to pharmacists, to rehab specialists, to clinical dietitians. Even now we are wanting even the Ayush doctors to kind of come forward and make us understand as to how can they play a role in providing safer care. So, in short, CAHO is nothing else but creating a movement for making healthcare delivery safer. I'll be very happy to answer any question that you have. Thank you.